The MONALEESA-7 trial was the only CDK inhibitor trial that was dedicated to premenopausal patients. And all three of the approved CDK inhibitors have shown roughly similar impacts on disease-free survival, roughly a doubling of disease-free survival. In this report, we are actually presenting survival analysis of the second interim survival time point. And for the first time for all the CDK inhibitor trials, we're seeing a survival benefit. Hazard reduction of about 30%, so 30% fewer death events in this trial. And this is notable because, number one, it means that there is the potential to extend survival. In fact, the way the survival plan is built for the analysis is that once you cross the boundaries and you show statistical significance, then that's the final analysis. So we can say pretty confidently that ribociclib does extend survival in premenopausal patients. So clearly this means that we can now push the boundaries further. If we can analyze which factors, including some of the molecular data that we've been generating, predicts for who lives longer, it may allow us to develop better approaches and better therapies. One of the questions is this a class effect? Are we going to eventually see this with other CDK inhibitors? Is it something unique about ribociclib? Is there something about the population? This was an all premenopausal population. There were also a higher percentage of patients from Asian countries. So there are some ways in which this population is different. Also, this trial did allow up to 1 line of chemotherapy in the metastatic setting. And while it was only about 15% of patients, that could affect the results as well. So we'll learn more as time goes on, but we're certainly excited to see that we have pushed the survival boundary.